Welcome to this explainer. Have you ever actually wondered how doctors manage to see right through our incredibly dense facial bones? Well, today, we're going to look closely at the fascinating precision of classical radiography. We're going to learn exactly how to use X-ray positioning as a precise geometric key to unlock those hidden sinus cavities. It is all about angles, landmarks, and absolutely perfect alignment. Here's our quick roadmap for today: unlocking the sinuses, the standard Waters method, the open mouth variation, the SMV projection, and finally those crucial image quality checkpoints. Section 1. Unlocking the sinuses, the keys to the skull. Okay, so before we can capture anything at all, we really need to establish our baseline tools. To reveal these hidden cavities, you literally have to master aligning very specific landmarks perfectly to the image receptor, or IR. The two heavy hitters here are the orbitometal line, or OML, and the acanthion, which is that exact point right at the base of your nose. Think of these as the literal crosshairs for our imaging equipment, because without mastering these, those hidden cavities are going to stay hidden. Section 2. Standard Waters method, revealing the maxillary sinuses. This setup for this first procedure basically acts as a strict procedural manual. You really can't skip a step here. Step 1. We begin with the patient in a seated, upright position. Step 2. The patient's mid-sagittal plane must be perfectly centered to the IR. And Step 3. Their shoulders have got to be placed in the exact same horizontal plane. We are essentially locking the body into a perfectly symmetrical grid before we even think about moving the head. Now, the single most critical metric in this entire setup is this number right here, 37. To get the standard Waters method right, you have to extend the patient's neck until that orbitometal line we just talked about is exactly 37 degrees from the image receptor. Not 35, not 40, 37 degrees is the magic, non-negotiable angle that actually shifts the dense bones completely out of the way. Right, so once you've dialed in that 37-degree angle, you center the IR right to the acanthion. The patient rests their chin, the mental point, directly on the IR, keeping that mid-sagittal plane strictly perpendicular. Then, the central ray, or CR, is fired exactly horizontally. It enters the vertex of the skull and exits precisely at the acanthion. And right before the shot, the patient must completely suspend their breathing. No movement at all. Just perfect, suspended geometry. Moving right along to Section 3, the open mouth variation, unlocking the sphenoid sinuses. So you might be wondering, how do we use that exact same frameworks to unlock a much deeper compartment in the skull? Well, the setup for the open mouth method is virtually identical to the standard method. It's the same collimation, same upright position, and the exact same 37-degree angle. But by having the patient simply open their mouth, we completely change the outcome. While the standard method evaluates the maxillary sinuses, this open mouth variation projects the sphenoidal sinuses perfectly, right through the open mouth itself. Now, if you're reading through these instructions, you might be wondering why it so deliberately specifies that the patient must open their mouth slowly. Like, why does the speed even matter? Is it just for dramatic effect? Actually, it's all about maintaining that incredibly delicate alignment we just built. Moving slowly ensures that the meticulously positioned 37-degree OML angle and that perfectly perpendicular mid-sagittal plane remain completely undisturbed. If the patient opens their mouth too fast or, jerks their jaw, the neck extension shifts, that critical 37 degrees is lost, and boom, the sphenoid sinuses end up obscured by bone again. Precision really does require patience here. Section 4, the SMV projection, the deepest reveal. Let's see how this builds on what we've already covered. The SMV projection basically acts as a master key. It's designed to reveal both the ethmoidal and sphenoidal sinuses all in one shot. And because we're looking at a completely different cross-section now, our collimation has to shift. We use a 10 by 12 vertical field, but we absolutely must ensure it extends exactly 1 inch beyond the tip of the nose and the lateral sides of the head, just to capture the full structural context. The mechanics for this one are honestly a bit wild. The patient is seated upright, right? But instead of resting their chin, their head is tilted way, way backward in hyperextension. The ultimate goal here is to make the infraorbitomeal line, the IOML, perfectly parallel to the IR. Once that's locked in, the central ray fires perpendicular to that IOML, entering right through the sella turcica. Once again, have them suspend their breath and take the shot. Section 5, image quality checkpoints, evaluating the reveal. Okay, the X-ray has been fired, but our job isn't quite done yet. How do you actually know if you nailed that 37-degree angle? Well, the proof is right there in the Petrus pyramids. In a perfect Waters method image, those dense pyramids are going to lie immediately inferior to the floor of the maxillary sinuses. If they happen to be superimposed over the sinuses, your angle was wrong. You also have to verify absolute zero rotation by confirming an exactly equal distance between the lateral border of the skull and the orbit on both sides. Left-to-right symmetry is an absolute must. Now, when we evaluate the SMV projection, the checkpoints shift. To prove you had sufficient neck extension and got that IOML parallel, you have to confirm that the mental protuberance, the chin, perfectly superimposes the anterior frontal bone. And here is why this matters so much. If the neck lacks that extreme extension, the mandibles will actually ruin your image by superimposing directly over the ethmoid sinuses. Plus, you're looking for the mandibular condyles to be positioned perfectly anterior to the petrous pyramids, with an equal distance from the lateral skull border to those condyles on both sides to prove there wasn't any head tilt. But despite the completely different geometry of all these methods, there is one universal baseline rule. For an image to actually be useful for a diagnosis, the soft tissue, the intricate bony trabecular details, and any air fluid levels simply must be crystal clear. It's not just about aligning the bones perfectly, it's about achieving absolute clarity so doctors can actually see what's going on in there. As we wrap up this explainer, looking at these incredibly rigorous procedures leaves us with a pretty fascinating thought. In an age where automated CT scans can map the human body in seconds, doesn't mastering these exact classical 37-degree angles feel like an essential, almost lost art form? The ability to see right through the complex architecture of the human skull simply by knowing exactly how to tilt the head is a real testament to the brilliance of anatomical geometry. Just a little something to think about the next time you see an X-ray. Thanks so much for joining me on this deep dive.